because conversion practices are not kind, they're very inhumane. So they disconnect the person from the community in such a way that they no longer feel safe in whatever space they get in. So on top of my head, self-esteem is the first thing. And once our self-esteem is struggling, it's very easy to struggle with issues of worthlessness, thus depression. And with depression, built fear that you don't feel safe. Gayism, lesbianism, bisexuality, whatever it is that fits the description of sexual orientation, gender identity, and expression that is not heterosexual or cis, is the aim is to remove, and they're never unkind. My name is Aineviona Charlotte Kigezo. I prefer being called Kigezo. The rest are for aesthetics. I am a clinical psychologist by practice, or a mental health practitioner for the generalization of it. What am I about? I am about serving the queer community in a way that they feel seen, heard, and understood when it comes to the mental health space.
From your professional perspective, what are the most concerning psychological impacts of conversion practices?
The long-term effect it has on self-esteem and how someone is able to reconnect with whatever they consider is their identity when they finally have a chance to understand that. Conversion therapy puts you in a place where it's easy to question everything and anything you are. So, meaning it makes even imposter syndrome worse. So, how a person who has gone through conversion therapy maneuvers life, be it their profession, be it their relationship, will be filled with a lot of doubt and confusion because of just how their identity was handled. Because conversion practices are not kind, they're very inhumane. So they disconnect the person from the community in such a way that they no longer feel safe in whatever space they get in. So on top of my head, self-esteem is the first thing. And once our self-esteem is struggling, it's very easy to struggle with issues of worthlessness, thus depression. And with depression, built fear that you don't feel safe, anxiety. So there's nowhere conversion practices create safety, but they also increase conversations on internalized homophobia, biphobia, transphobia, because we don't get to understand why other people can be themselves and we can't be ourselves.
How do these practices contradict established therapeutic ethics and standards of care?
Most importantly, therapy is to be kind. That's the most of it. Therapy is human-based. Therapy, depending on the techniques that are used, but it's very human-based, human approaches. And conversion practices are normally very unkind. The aim, they more like represent exorcism. The point is to remove gayism, lesbianism, bisexuality, whatever it is that fits the description of sexual orientation, gender identity, and expression that is not heterosexual or cis. Is the aim is to remove, and they're never unkind. Therapy is based off being like a very generous person, a genuine person, being someone that is of the people. Ubuntu is the center of therapy, but conversion practices tend to lack that. They aim more on what the society deserves for this person rather than what this person feels is their deserveth of for themselves. So with practices like that, that's not therapy. And that's why a lot of times there's been an encouragement not to call them conversion therapy, but conversion practices, because they do not fit the understanding of therapy, which should be kind, human-based, unconditional positive regard, meaning the client knows better, the patient knows better, the person seated across the table from the therapist or in that chair knows better about their lives. And conversion does not seem to focus on that. It focuses on changing and fixing in such a way that a person is hetero and safe.
What patterns of trauma do you observe in people who have undergone conversion practices?
I think the patterns would be almost the same as someone who has experienced PTSD. So constantly on edge, feels very unsafe no matter the environment, has issues with trusting people or easily building trust, struggles with rapport, internalized homophobia, biphobia, transphobia that is always projected actively, outwardly. They will perpetrate violence towards other people or people within the environment that express their identities or their expressions. They will, because I mentioned about self-esteem, so they struggle with self-efficacy, they struggle with even drawing boundaries, being able to communicate what they think is theirs or not theirs. And because now things like depression and anxiety find root into that, we'll have persons who are struggling with suicide ideations or ideas of wanting to kill themselves because they feel like they don't belong. Some of them are very unsettled. They startle easily. It takes very little to scare them. Yes, so it would definitely be the same signs as PTSD, but it's important to acknowledge that these symptoms have to have existed more than 6 months prior to the incident in order for us to say they present as PTSD.
What challenges do you face when helping clients recover from conversion practice experiences?
I think most importantly is the environment. The fact that they're going to go back to the same environment that perpetrated conversion. So the first challenge is how do we relocate the patient, the client from that space? But you also need to understand that when you come from a community that has made you feel like you don't belong, it's easy to have something we call learned helplessness, where you can't separate yourself from this community because there's a certain trauma bond. So there's a chance of the person not seeing the value of leaving that environment because they have a certain attachment to the environment, which is unfortunately a negative attachment.